Hi, welcome back to Nursing Matrix. Today we are going to look at Roy's adaptation model explained. How do nurses help patients adapt? So if you're ready to get those brain cells milked, let's get started. So first off, who is Roy? So Roy was a nurse theorist who developed the Roy Adaptation Model in the late 1960s and early 1970s. So she worked as a pediatric nurse and she noticed that kids weren't just sick. They were actually adapting to their illness and their treatments. So then she created this model to explain how nurses can help people adapt to changes in their health. Okay, so what is the overview of the theory? So Roy saw people as adaptive systems, like we constantly take in information from our environment and we respond to it, right? Just think about it. When you walk into a room and see a big spider, your natural response is to scream and try to kill it. That's an example of adapting to a stimulus. Or when you feel a pain, your body adapts by sending signals to heal and protect itself. So Roy believed that nursing is all about helping people adapt to these changes. Okay? So here's a picture of the Roy Adaptation Model. At the center, we have the person as an adaptive system. And this system takes in input and produces an output. So inputs could be anything, like changes in health status, stress, development, life transitions, disease, injury, and treatments. Those are all things that could cause a change in a patient's health status. Now, the output is the response to those inputs. So it's really important to remember that in nursing, we aren't just treating diseases, we are helping people adapt to diseases. So the goal of nursing is to promote adaptation in the 4 modes of the adaptive system. Okay, so what are the 4 modes of adaptation? So there are 4 modes of adaptation: physiological, self-concept, role function, and interdependence. So the physiological mode is how the body responds to changes. So examples include pain, blood pressure, heart rate, nutrition, elimination, sleep, etc. The self-concept mode includes the patient's feelings about themselves. Changes in this area might be related to body image, self-esteem, personal identity, and spirituality. The role function mode includes changes in family roles, work roles, and social roles. These are all the roles that we take on as we live our lives, such as being a student, a son, a worker, a volunteer, or a friend. The interdependence mode is about how we interact with other people and how we rely on them for help. So changes in this area might include changes in support systems, family dynamics, or social support. Now, what is the nursing process used in Roy's adaptation model? So Roy believed that the nursing process should be used to plan care for patients. So that means assessment, diagnosis, outcome identification, planning, implementation, and evaluation. So this helps nurses systematically think about the patient's needs and develop a plan to meet those needs. Okay, so let's put it all together with a quick case study. So imagine you are a nurse taking care of a 68-year-old woman named Mrs. Hernandez who had a stroke. She's having trouble with walking, talking, and doing things around the house. She also feels sad and lonely because she doesn't have as much energy as before. And she's worried about how the stroke will affect her relationship with her family and friends. So how could you use Roy's adaptation model to help Mrs. Hernandez? So we would do an assessment first to figure out what kind of help she needs in each of the 4 modes. So in the physiological mode, you might work with her doctor to manage her pain and help her move around safely. In the self-concept mode, you would encourage her and celebrate her accomplishments to boost her self-esteem. In the role function mode, you would connect her with resources that could help her do things around the house. And in the interdependence mode, you would make sure that she has a support system in place to help her cope with the challenges ahead. Okay, so now we're going to compare Roy's theory to another nursing theory, Orem's self-care deficit theory. So if you want to learn about that, you can click on this card right here. Okay, so here's a mind map of Roy's adaptation model. So hopefully this will help you visualize the main points of the theory. So you can download the PDF of this in the description. So what are your thoughts on Roy's adaptation model? Let me know in the comments. And if you found this video helpful, don't forget to like, subscribe, and check out these other nursing theory videos. Thank you so much for watching. Stay safe, and I'll see you next time. Bye.